Welcome back to this segment of Ethnic Health America. Our special guest, Dr. Mike Giacomo, is also one of our favorite guests. He's a podiatrist, and want to thank him for joining us.
Thank you, Dr. Laura.
Tell us how you got interested in podiatry and what the process was like.
I grew up in the Midwest, and my folks had a friend who was a podiatrist, foot doctor. And when I was a little kid, I said, I think I'm going to be a dentist. So this gentleman met me one time at the water ski club we were in, and he said, what are you going to do with your life? I said, I'm going to be a dentist. He said, great, why? I said, I don't know. It just sounds like a good idea. He said, well, why don't you come visit me in my practice sometime and let me show you what goes on. And I did that a number of times, and then when I went to the University of Iowa, he introduced me to some doctors that were up that direction, and I was just sold. I was enamored by the fact that you can have someone come in discomfort, and you can make them feel good on the spot, and I was sold.
Let's go over some chiropractic terminology. People hear these terms, but they don't really know what they are. What are corns?
Well, podiatric terminology is very common, and corns basically are accumulations of skin on the toes. Generally, it's associated with a toe that instead of laying flat is bent. And so what happens is shoe pressure will accumulate tissue. That tissue is called a corn. That in turn actually makes pressure on the nerve underneath and is uncomfortable. So most people think a corn is a growth. You kill the growth and it goes away, but it's really the deformity of the toe, generally the bending of the first knuckle in the toe, that is the underlying cause of the problem.
What about a bunion?
A bunion is also a deformity of the foot that happens to be congenital in origin. So a bunion is where the first metatarsal bone in the foot drifts towards the other foot. Now most people look at a bunion and they see a bump on the side of the foot and they think, I just grew a bump on my foot. But in reality, it's a shifting of bone. And that then is associated with the big toe moving towards the small toe side of the foot. This then accentuates the hammer toes that are oftentimes associated with the corns we just spoke of.
Bone spur?
Bone spurs are accumulation of bone, and these typically will occur where there's traction. For instance, in the Achilles tendon, we frequently see athletes who have Achilles tendon traction type spurs. These project off of the back of the heel bone. And what happens is a runner, for instance, or someone who does a lot of basketball or other court activities, they develop that calf muscle and it gets real strong, but it gets short. And that makes the Achilles tendon pull a little harder on the heel bone. That creates traction, and that traction creates growth of bone. A similar spur is one on the bottom of the heel, which is traction of the ligament called the plantar fascia as it pulls against the heel bone in its pathway going up towards the toes. This is oftentimes associated with a flat foot or also associated with a shortened Achilles tendon.
How can people tell if they have an arch problem?
Generally, you can tell if you have an arch problem by looking at your ancestors, the hereditary nature of the thing. So for instance, if you have an arch problem, or you think you do, and you just simply have a flat arch, but if you look at your parents, grandparents, or siblings and nobody has any associated deformities, such as bunions, you generally don't have to worry too much about it. But the easy way to do it is have someone else eyeball you from the back as you're standing barefoot looking away from them, and look at the Achilles tendon's direction downward. If the Achilles tendon direction downward is pretty much perpendicular to the ground, you generally don't have much of an arch problem. If it deviates outward towards the small toe side of the foot, then you generally know that you have some arch problem.
We've often talked about the shoes that people select, especially women's shoes. What's been your experience about the selection process for shoes?
Well, it's real interesting you asked that, because there's been a phenomenon now, especially in the sports world, where people are going to, in quotes, barefoot running or unconstructed shoe running. And they're thinking this is getting back to nature and so forth. But I've already accumulated a handful of people with metatarsal fractures. The last week I had a young lady who had a 2-inch piece of wood stuck in her foot with a very deep infection that we had to take to the operating room. So as far as athletic foot gear, what we always talk about is get the proper shoes for the proper sport. So for instance, most of us say the word tennis shoes when we mean any athletic shoe. Tennis shoes are specific for the sport of tennis. They're flat. They don't give a lot of arch support. They're not meant to, and they're not meant for running. So if you're a runner, get a good quality running shoe. If you do court sports, basketball or what have you, get a court shoe. Now, women's shoes. Women typically are wanting to wear, especially in their younger years, an elevated heel. If you wear a little bit of an elevated heel, 1.5 to 2 inches, probably no problem. If you have a little bit higher than that and the sole is raised, so you have sort of a platform effect, not much of a problem either. But if you wear in the 2-inch to 3 to 4-inch range frequently, what happens is, number one, you load so much pressure on the front part of the foot that if you have one of those deformities we talked about earlier, such as bunions or hammer toes, you put more pressure on it, you make it grow faster, even though its origin was heredity. Now, the other thing that you do, if you're a woman and you're wearing high heels all the time, is you ultimately shorten your Achilles tendon. As your heel goes up, your Achilles tendon relaxes. Nature doesn't like a void like that, and it will shorten the tendon. That makes it uncomfortable to wear flat shoes in later life.
So the old expression that we talked about earlier, Jimmy Choo may not be for you. Is that correct?
Jimmy Choo may not be for you, or at least maybe only one day a week.
All right. Tell us about the things that you can do now as a podiatrist that you couldn't do 10, 15 years ago.
You know, it's really neat to watch medicine evolve, and you've seen it in all the fields that you interview, but one of the nicest things we have are these miniature instruments now. So for instance, again, for the athletically endeavored type person, a lot of people develop bone spurs, as we talked about, around the ankle bone. And it frequently occurs with people who do basketball and other court type activities. And these spurs in days gone by used to be somewhat disabling, and they used to be a major project to get them gone. We'd have to make a big 3 or 4 inch opening and use hammers and chisels and so forth and take them out and lay somebody up for quite a while. Nowadays we have these miniature scopes. They're 4 millimeters in size. We make a small opening on one side of the ankle. We put a scope in, which is attached to a miniature TV lens. We look at the TV monitor, and on the other side we put little vacuums and drills and suction devices to clean things out. Usually requires only a stitch on each side, and that takes care of the problem. Another one that I'm really excited about is also the use of a scope, and it's also a 4 millimeter scope, and that's for people that have painful heel spurs. So most heel spurs we get better with typical type of treatment known as physical therapy, stretching exercises, orthotics, shoe devices. In those rare cases that people don't get better with it, we can treat this with a scope. I go in with a little 4 millimeter opening, release the ligament known as the plantar fascia. It's literally a 5-minute operation, and the patient walks away. They have a stitch on each side of the heel, and within about 4 days they can take a shower again, and they're back to their regular activities in 2 to 3 weeks. Another one that we've talked about maybe a couple times before is shockwave therapy. Now we have ultrasound, which is the physical therapy type thing where you put a sound wave on someone and you warm up the body part, but we have ultrasound now so powerful that it can fracture kidney stones. In kidney stone removal, it's called lithotripsy. In the foot, to remove the effect of bone spurs, it's called shockwave therapy. So essentially, a large machine is utilized, and it is applied to the area where the bone spur is, and it literally dissolves the problem.
Well, Dr. Giacomo, thank you again for joining us. I think people should know that not only have you had a number of prestigious positions with professional athletic teams and the podiatry group, but you give a lot to this community. And for that, we're really grateful, but we're mostly grateful for you taking the time, and I hope people remember just a fraction of the information you provided. Thank you very much.
Thank you, Dr. Lenore.
We'll be right back after this break.